Hey, I'm Cristina Arroyo. I will talk with another topic that I love as Sarah, that it's multi-drug resistance among planetary health. So this is an emerging problem in our clinical settings. Why is so important? Why is we are so worried about? Because this is our reality. Look at this. This is an antibiogram of our urine culture, and there is only few options to treat. So we are faced with multidrug and pan-drug resistant bacteria. What is the burden of this antimicrobial resistance? It's huge. So it's almost 5 million of deaths associated with infection, with multidrug infection. As Sarah said, it's a silent pandemic. As you can see here, it is one of the highest causes of death of infection. What is the origin of this antimicrobial resistance? This is so interesting because the emergence of antibiotics predates the discovery of antibiotics in the 1920s, because we found the genes encoding resistance to different antibiotics in the permafrost sediments in Antarctic, in other areas. And this is evolution of a lot of years between susceptible genes transmitted to bacteria and with mutation and with antibiotic pressure in the last 70, 80 years, and the transmission to the human-to-human animals and environment that caused the spread of these multi-drug-resistant bacteria. There are plenty of factors influencing this increasing of multi-drug resistance. Of course, the widespread use in our clinical hospital settings, but also the veterinary use, even though that growth promoters are forbidden in Europe since, I think, 2006, are used worldwide in other countries, especially in low and middle income countries. Lack of sanitation and water contamination, as Sarah told us, is a very important factors that's increasing this multi-drug resistance, international travels, and climate change. There is a relation between the climate change impact and infections and also multi-drug resistance. Why? There are plenty of relations. High temperatures, the floods, but for example, high temperatures increasing the functions or facilitate the functions and promoting the growth of some bacteria. So we found infections in altitudes and latitudes that we haven't seen before. That causes more infections, cause more pressure, antibiotic, and the facilitating of the spread. Also the foodborne, the vectors, and as Pera told us. So even in the clinical setting and the community setting, we see more infections. There is a complex interactions across One Health sectors. Gram-negative bacteria, enterobacteria, for example, are living in our gut, in the microbiota. That's another super interesting subject that I will talk to you another day. But there are in the microbiome of humans and animals, and also these genes of transmission are in this microbiome facilitating the spread of this multi-drug resistance through animal to human, also the vectors, birds and mosquitoes, the connection with the hospitals, so nosocomial infection, and the contamination of water and other parts of environment. So there are plenty of interventions to tackle MRI. This slide is only to show that we have to work together. There is different aspects to have to work: agriculture, the individual, government, environment, trade, international, public health. We have to work together, and because it's a multifaceted intervention to tackle. But especially, and the topic that we have to talk today, is to invest and research for the surveillance and development of innovation. There are some key aspects of we may tackle this multi-drug resistance, but of course advancing research and education and in this area, and promoting studies, monitor and track MRI trends globally, improve the tools for rapid MRI detection, as Sarah told. I think it's one very important key tools, promote the non-antibiotic therapies and preventing measures. Antibiotic stewardship programs, very important, work with the team infectious diseases, use the rationale of use of antibiotics individually, in the community, and the hospitals, and invest in discover new antimicrobial agents. There are few enterprises that are working on the new discovery of antibiotics, so we have to push public and private sectors to invest in new antibiotics and encourage a corporate investment in MRI solutions. And of course, using the cutting-edge technologies like AI and genomics in MRI research. The future is now, plenty of new studies going on with MRI, machine learning, ya, he visto que me quedaba poco tiempo, me he puesto nerviosa.
Bien.
No, multiple studies in machine learning, AI in these areas. So let's move forward together. This is the message, but we have no time, so we can discuss later in the tables. Thank you.